Sarah Palin was right. I said Sarah Palin was right. Listen to this. The D.C. Examiner, Iowa Republican Senator Charles Grassley, Byron York reporting, who's working with the Finance Committee Chairman, Senator Max Baucus, on a health care compromise, has just issued a statement saying that concerns about end-of-life issues in the health care bill are entirely legitimate. In addition, Grassley says the Finance Committee has dropped end-of-life provisions from consideration entirely because of those fears and also because of the concerns that they could be implemented incorrectly. Now, I want to get to that point in a minute. But here's part of his statement. The bill passed by the House committee is so poorly cobbled together that it will have all kinds of unintended consequences, including making taxpayers fund health care subsidies for illegal immigrants. On the end-of-life issue, there's a big difference between a simple educational campaign, as some advocates want, and the way the House committee passed bill pays physicians to advise patients about end-of-life care and rates physician quality of care based on the creation and adherence to orders for end-of-life care, while at the same time creating a government-run program that is likely to lead to the rationing of care for everyone. So Grassley, the ranking Republican on the Finance Committee, who's in there negotiating, I guess, with Baucus and the rest of them. Baucus. I know it's Baucus. On a bill for the Senate, he's saying we're not putting that in our bill because the people who are concerned are absolutely right. Now, here's the problem. Even with it out of a bill, the government is still going to have the final say on who gets one, when they get what, and if they get what. So these decisions will still be end-of-life decisions, and they will be imposed by the government. We see that in the UK. We see it in Canada. We see it everywhere where there's government-run health care. Right now in our country, I must say, we treat our senior citizens better than any other country on the face of the earth. Let me emphasize that again. We treat our senior citizens better than in any other country on the face of the earth. Do you want to know why? Because but for them, we wouldn't be living in this country this way, would we? And we need to do the same for the coming generation, because one day, many of us, I'm 51, almost 52, will be senior citizens, God willing. And hopefully we will leave this country as well, if not better, than the country we received from our senior citizens. And so we have to show compassion and respect to our senior citizens. Let me explain. When you have a government panel of bureaucrats who go thumb up, thumb down, like they did in the great, days of the barbarians, then thumb down means thumb down, damn it. No drugs mean no drugs. No treatment means no treatment. No new technology means no new technology. And today, if you don't live in Oregon or some of these other states, as I explain in Liberty and Tyranny, we do everything we can to save somebody's life. I don't care how old they are. I don't care what their circumstances are. If they can afford a drug or they can't afford a drug, if they can afford a procedure or not, we find a way in this magnificent society to take care of our people. Family members find a way. Sometimes it's hard. Sometimes it's expensive. But what the hell? We're talking about the life of a loved one. In other countries, as a matter of law, you can't. They say no, and no means no. So people suffer who need new hips. People suffer who need new knees. People suffer from heart disease who can't get pacemakers or procedures that they need. People suffer. They're in pain. Their lives are cut short. The quality of life is cut short. In our country, we pride ourselves on taking care of our people. Now, I want you to think about something. Who in this debate has passion for his fellow man? Or should I say, compassion for his fellow man? Who in this debate has compassion for his fellow man? The big-time statist who always claims to care about the little guy? The big-time statist who always claims to care about the senior citizen? Who always claims to be protecting Medicare? The big-time statist who always claims to be for the little kids? To try and find answers to diseases and on and on. Really? Well, it doesn't look that way from where I'm sitting, does it to you? Has this not exposed, once and for all, the left for what it is? Has it not exposed the leadership of the Democrat Party for what it is, once and for all? Has it not exposed Obama for who he is once and for all? They're cold, they're calculated, they're strategic. They want control over you. They want power for themselves. They don't give a damn what you think. They don't give a damn what you want. They've got the system turned upside down. We, you and me, are supposed to exist for them, I guess.